So again, for the record, my name is Jonathan Jones. It's my pleasure and my privilege to be your host and moderator for this afternoon, this evening. Today is June the 22nd, 2025, and it's Sunday evening at 5 p.m. Eastern Standard Time. And someone invited you to this presentation because they thought a lot about you and thought that there would be some value here that you could benefit from. And we applaud you for taking time out of your busy schedule and being willing to join us as we discuss this very important topic. And as I mentioned, Dr. Prasad is with us today. And if you have a cancer survival story, we'd love to hear it. So we look forward to hearing from some of you today as well. So, but to get us started, we have to do some housekeeping. And this is the disclaimer that we have to share with you so that you are aware that we are not making claims that anything that we have will treat or cure disease, okay? So we have to share this with you by law. The FDA has not evaluated these statements. Testimonials that you're going to hear are anecdotal. Results are atypical. That means that what happens to one person may or may not happen to you. Neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, or any of the authorized representatives are making any claims that supplements that we recommend will treat or cure any disease state. This presentation is for information and education purposes only. It is not intended to be a substitute for a visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust. And when we have Dr. Prasad making comments today, please remember that Dr. Prasad is a scientist. This is Professor Prasad, so he's not going to put himself in a position to give comments, recommendations, suggestions about treatments or diagnosis. I've been really impressed at the level of humility of Dr. Prasad. I've had him on the phone with doctors, with specific individuals who had issues. And the doctor would say, no, I do not want to have my patient do this or do that. And Dr. Prasad humbly simply says, well, you are the doctor, it's your patient. And I understand that. He would only simply relate what the science says. So each person has to make their own decision on that. And Dr. Prasad certainly has no shortage of information and knowledge about what the science is when it comes to this. But before we get started, I feel compelled to share with you guys a story that was very, very touching for many of us about a year or so ago now. And Alfreda Strong may be on the meeting with us right now. But this is just something that happened to one of our clients, a very dear woman, who said that she wanted to live. She simply said she wanted to live, and she was doing everything that she could to live. She had cancer and was recommended to us to see what we could do to help her. It was an aggressive, fungating breast cancer. And it was so aggressive that it grew to the size of about a football. It was about 11 inches across from left to right. It was on her left breast and about 5 inches, 4 to 5 inches from top to bottom. And it raised up about 3 or 4 inches exposed outside of her body. So she's walking around carrying this football that she's trying to get rid of. And she decided that she did not want to take chemotherapy, but she decided that Dr. Prasad's science was rock solid and sound. And she went on, she decided to do therapeutic doses of his formula, which is triple doses of microdaily 3 times a day. And the very week she started taking it, she said the pain went from level 10 down to 5 in the first couple of days. Shortly after that, she said the pain was down to level 1. And it was kind of interesting. That's notable because I remember the first time we had a conversation with her and the family. Her first question was not what can take care of my cancer. She said, do you have anything for pain? And I said, well, we don't necessarily we don't address pain, except that we try to help you and your body deal with the cause of the pain. Within the first week, she went from 10 to 1. And not because of any pain recommendations we gave her, but we gave her what Dr. Prasad said that the science backed. That if you elevate high doses of antioxidants in the body, it would block the uptake of glucose and glutamine. And she believed it. Her name is Basal, a very wonderful woman. So about 2 weeks later, she's going out to dinner. She's enjoying her life. She went dancing, and she felt like she could win, and she was winning. And pieces of this thing was starting to fall off in her bandage. Every time she changed the bandage, there was pieces of this mass, falling off into the bandage. Then it wasn't going away fast enough for everyone. So she went and talked to another doctor. This other doctor, oncologist, recommended radiation. She did the research on it and decided that she would do the radiation. Dr. Prasad spoke directly with this oncologist on that occasion. The oncologist said, I do not want you to take anything with antioxidants. And Dr. Prasad said again, you're the doctor, it's your patient, it's your decision as to what you choose to do, but here's what the science says. And that's the way that conversation went. I was blown away personally because I want to tell the doctor something a little bit different than what Dr. Prasad said. I'm just being quite honest with you. That's not what I wanted to say. But I'm not a doctor, so I only facilitated the conversation. But Brazil decided that she preferred what Dr. Prasad said. She continued to take his formula throughout the treatment. After the first 1 or 2 rounds of the radiation, she said she thought she was going to die. She told the doctor that she wanted to discontinue. The doctor said, please don't. Please do not discontinue. And she said, Brazil sent us this as a quote. She said, the doctor said, that thing is dying. We've never seen a reaction like this before. Please continue. I'll instruct the team to protect you more as far as the radiation was concerned, because apparently they were just blasting her anywhere. They weren't targeting the mass itself. She was getting burns all over her back. She was just getting slammed with radiation everywhere, not just on the mass. But the doctor saw something that she had never seen before, which again makes me scratch my head. You didn't think this was going to work, and yet you did it anyway? Anyway, that's a whole other conversation. And sure enough, about Alfreda, if you're on here, you can correct me if I'm wrong, but it was about 2 weeks later that the mass kept getting smaller and smaller and smaller, because the doctor came in and sat down with her and with another doctor or so, and sat down, turned the chair around and said, I've never seen anything like this before. She said that thing is dying. This is after all the treatments were over with. She said, I don't know what else to do. She said, go back to the team that's helping you. She said, I know you've been continuing to take Dr. Prasad's formulas. So she knew that she hadn't stopped. And because of the fact that it was behaving differently, that helped her to appreciate too that something else must have been part of the equation. But she said, just go back to the team that's helping you and I followed their recommendations. And she did. She came back. We gave her further suggestions on that. But the one thing that the rest of her medical team did not do, that I still feel created part of the problem, was they did not give us the blood test and all the other information that we needed to know how she was doing. And she ended up going back into the hospital, and they shut down everything that she was taking, and her liver could not handle the onslaught of the dead cancer cells in her body. So eventually she passed away, not from cancer, but from her liver having trouble, apparently, processing what was going on inside her body. And the doctors, I don't want to point the finger or say anything or create a question mark around what possibly happened. I don't know, because I wasn't there. We don't have all the medical records. I'm just sharing with you an amazing story. And it was very sad for us because Brazil wanted to live, and she had won. She won her fight. So, but I want you all to say that, because anytime we talk about cancer survivors, we don't want to. I never want to ever forget that this woman did what she did, and she did beat it. She did beat it, but other issues were at play that came into the picture, factored into the equation. So, but we're going to hear from some of you in a moment about some of your stories. So if you have one that you want to share, again, be ready to do that. But be mindful that Cancer is not new at all. Right now, statistics are indicating that there's a couple million people every single year that are coming down with cancer. That number is actually going higher. The National Institute of Health says that all-cause mortality, including cancer, is higher since 2021 than ever before. So you just think about that. Between 10 and 20% more people are dying from cancer every single year right now than ever before. The new expression turbo cancer has come into play. So of the 2 million new cases every year, it is estimated that some 600,000 of them are going to die this year. We're halfway into the year right now. That's 1,700 deaths every single day. That's like having a 9/11 every other day. So from the time we started this presentation, a 9/11 happened. And you can turn on the television right now and there will be no breaking news about it. Nothing. No one will say anything about it. But that's what's happening right now, every single day. So cancer is still a pervasive, horrific issue that's plaguing mankind, humanity, globally. Breast cancer, 32%. These are the most common forms of cancer right now. The only difference between the most common forms of cancer between men and women is for women, it's breast cancer, and for men, it's prostate cancer. That's what you kind of see here, the difference between these two screens. But cancer is what it is. And Dr. Prasad has said, I love his expression, cancer is cancer, no matter what kind it is. So they have to eat. They need glucose and glutamine. So, but anyway, that is what's happening. Cancer is very, very real. The last slide that I found from the CDC's website was this one, 605,000 per year. But as you can see, though, that last statistic, that standalone statistic, was 618,000 projected this year will die. So they know that the rate is actually going up. COVID is no longer number 3 on the list, by the way. They have moved this accidents or unintentional injuries up to the number 3 spot. They call it accidents. It used to be iatrogenics or medical mistakes. Some doctors and some scientists, some researchers have said, use the expression death by doctor to describe that accidents, because that's not about talking about a car accident. That's talking about medical mistakes that take place within the medical system. Is the number 3 leading cause of death. So if you really want to improve your chances of living a good, long, healthy life, then you want to take charge of your life. Take charge of your health. Be your own health advocate. So these are just some more of the statistics. This is one of the ones that the only one that I really want to pause on is because, as you can see, when it comes to preventable cancers, the leading cause of preventable cancers is smoking is on the list. It went away. I was trying to write on the screen. But smoking, it won't let me write on the screen. Sorry about that. But smoking is on the list. Obesity is on the list. UV radiation is on the list. Physical inactivity is on the list. Poor diet is on the list. And these are all things that you have control over. And Dr. Prasad has formulas that support in each of those areas. My second favorite that he has to support us with this challenge is the one on obesity, because Dr. Prasad has formulated the GLP-1 boost that causes your body to make a GLP-1 antagonist, stimulates your own natural production of GLP-1, which then causes your body to behave differently as far as food is concerned. It sends a signal quicker to your brain that you've had enough to eat. So you might want to really take a good look at that if you're looking to try to avoid getting cancer, not to mention the other things that Dr. Prasad is going to tell us about. Including radiation, his formulas address that as well. And when it comes to the outcome, these are the top 5 treatments for cancer, surgery, chemotherapy, radiation, targeted therapy, and immunotherapy. Those are what is most commonly used right now, but all of them come with side effects. Most of the side effects we're all familiar with, including nausea, vomiting, fatigue, hair loss, immunocompromise, and cognitive impairment, chemo brain. Most are familiar with all of that. And this is one slide here that if you want to get a snapshot of all the side effects of the conventional treatments, just take a screenshot of this one right here and you've got it. Until recently, I thought that these immunotherapies was the holy grail of the Shangri-La of conventional treatments. I did. And I don't know enough about it as yet. Maybe Dr. Prasad can give us some comments on it. But we just recently, about 2 weeks ago, got a client that her whole skin, her immune system is attacking her skin. Her immune system is attacking the pigment in her skin, like vitiligo. And her immune system did not do that until she received an immunotherapy trying to get rid of a cancer in her body. And not only is she suffering from treatment failure, she also has an immune system that's very confused. It doesn't know the difference between self and non-self. When it was supposed to be taking care of the cancer cells, it decided to eat her pigment in her skin. And so she looks like vitiligo all over the place. And I did not know that that was one of the consequences of that particular treatment. But anyway, I'm just passing that on as a potential side effect when it comes to that treatment, which has been touted as one of the most promising ones. But let's hear some comments from Dr. Prasad when it comes to cancer. And here's Dr. Prasad's accolades on the screen. He's the world's first radiation biology PhD and so many other things. Under credentials, you'll see he was a professor at University of Colorado School of Medicine for more than 30 years. Drop down a couple of bullets and you'll see that he was invited to be a member of the Nobel Peace Prize nominating committee for candidates in medicine. So this man has been around the block a few times. He's not some college kid who's hoping to make a name for himself formulating products for a company. He came into this company with a storied background and credentials that are out of this world, and 250 some peer-reviewed publications and counting. He's still writing papers, still giving lectures, all around the world right now, and he's 90 years young. And so this is who we have that's helping us with understanding how the science works when it comes to fighting this dreaded condition that is plaguing humanity right now. So it's my pleasure and my privilege to introduce into our discussion right now Dr. Kedar Prasad. So Dr. Prasad, we can't thank you enough, and we welcome you to our discussion, sir. We appreciate your taking time out of your very busy schedule and being willing to come and share some comments with us today.
Thank you, Jonathan. I always enjoy being with you and our engaged family members, and anything I can contribute for them to clarify certain issue, I will be glad to do it.
That's wonderful. Thank you very much. Would you mind telling us a little bit about you've written a paper about how high dose antioxidants have an impact on cancer. Could you tell us a little bit about that? And then we're going to share some testimonials.
Yeah, and then we will discuss what one can do to reduce the risk of among survivors, the people who survive cancer treatment, and then what we can do to reduce further problem.
Good.
They have all problems associated with among survivors. But as far as the cancer treatment component is concerned, and you very elegantly described that cancer cell, no matter what kind of cancer cell is, no matter what stage in the cancer cells are, no matter whether it's tumor sensitive or tumor resistant, makes no difference. They require two micronutrients for survival. One is glucose, one is glutamine. And if you deprive them, and they have been shown in experimental system, all will die, because glucose used for generation of energy. If you have no energy, cell cannot divide. And glutamine used to making a synthesis of vital molecule like RNA, DNA. And so if you don't make a vital molecule, you cannot divide. So it's very simple. It is so simple, it's hard to believe it. And it has been shown with the thing that we are recommending it, that this could be true. And one example, Jonathan, you gave about breast cancer. And so high dose antioxidant for a long time. I published, other people have published many papers. that high-dose antioxidant kills cancer cell, but not normal cell.
Hmm.
But nobody paid attention to because the doctor thinks, oncologist think, antioxidant will protect against chemotherapy and radiation therapy.
Yeah.
And he's right. But as long as low dose of antioxidant is concerned, then he's correct. Because if you use a low dose of like preventive dose, for example, antioxidant, then indeed it will prevent the effectiveness of chemo and radiation therapy. So their fear is justified. But they are not accepting as yet, and we have a plan to run a clinical study that high dose antioxidant can kill cancer cell by inhibiting the uptake and metabolism of two vital nutrients, glucose and glutamine, that cancer cell need to survive. And high dose antioxidant does it. And we use multiple antioxidants because some of them will block glucose uptake, some of them will block the glutamine uptake. So that's why combination is very useful. And so that's why sometimes people use one dose, very high dose, but they get all kind of complicated results. Plus, if you give any antioxidant, whether it's low dose or high dose, they get oxidized because if your body has if you are older, have a cancer, and already have a high dose of very high environment of oxidative stress, and in the presence of oxidative stress, individual antioxidant will get oxidized, then will act as a pro-oxidant rather than as an antioxidant. That's why we always use multiple antioxidants. And so this is very good for as far as the treatment is concerned. And I think it is so cheap and so effective. And still, oncologists are not ready to accept it until we run a clinical study. We have all anecdotal story, many, you know, at least I would say what I heard is at least 50 people we have it, but they are all anecdotal story.
Right.
And no oncologist will agree to go with even as a case report.
They won't go on the record.
Yeah, they have nothing to do with oncology.
Right.
But if we run in a phase 1, phase 2 clinical study, we are going to run one in Brazil and one in a Duke University. And we are working with those scientists to do it. We are securing fund, but that's a different issue. And so now the question is that current therapy that we have, radiation and chemo, some people have long-term survival. And the question is then what they should do. What are the potential hazards of those people who survive 5 years, say, for example, after cancer treatment? They face first is poor quality of life. Like you said, we have brain fog. We have all kind of poor quality of life is not very good. That's one.
Right.
Second thing is that 10 years down the line, and I know several cases, some of my friends, kids, that they get cured, but 10 years later, they develop a same primary cancer that was cured.
Ugh.
In addition to that, they develop another new cancer on a different types of cell, different area of these things. So it is not the same type of cancer, but different secondary cancer, we call it, they develop. For example, if you are treating a cancer treatment, say breast cancer, so they can reoccur breast cancer, or they develop a new cancer, for example, could be brain cancer, could be leukemia, away from as long as they were in this, because what happens, when you irradiate the tissue, they release a lot of pro-inflammatory cytokines, and they migrate through the bloodstream, go to affect the normal cell, further away from the cancer cell, further away from the cancer. And then they show later on that consequences if you don't do anything. And then there is also risk of a non-cancerous diseases. For example, if you have treated with radiation, then you can have a soreness lesion of the muscles or brain that is difficult to heal.
Right.
So these things occur among survivors of cancer. So the question is what you do to reduce the risk of those things. Very vital question. First, you have to know how the cancer cell become cancer from normal cell. See, normal cell normally divide. Cancer cell has to arise from an organ which has a dividing cell or has a potential to divide, like liver. Normally, liver don't divide, but it can divide if you have damage, and so it is very important. So they differentiate and they die. Normal cell divide, and when many things happens, they die. No, differentiate and then they die. This is the normal pattern. But when something happens to the dividing cells, for example, you can induce mutation in oncogene that can increase the risk. You can
And
suppress.
radiation can cause that mutation.
Yeah, that's right. Radiation will cause mutation. Yeah, of course. And also, radiation can, or chemo, either one, or any increased oxidative stress will do that.
Right. Okay.
And
Something radical.
so increased oxidation will do. So you could, and this happens by chance. There are many genes. It happens to you by chance. It happens to in 1% or few
Mm.
percent. And then you have also suppressor oncogene. So they activate suppressor, so they downregulate. Oncogene, they get upregulated,
Yeah.
up,
Yeah.
and suppression, they downregulated.
Yeah.
And the third, which I suggested long time ago, is called differentiation genes. In other words, normal cell divide, differentiate, and die. So if you have mutation in differentiation gene, like in this case was cyclic AMP related, and then you have mutation there, then they can't differentiate. If they can't differentiate, they become cancer cell. So there are three spots that are susceptible to change by oxidative stress: oncogene, tumor suppressor gene, and differentiation gene.
They're saying, I read a report, Dr. Prasad, where right now they're trying to figure out why, in many cases, more people, the tumor suppressor gene is being turned
Yes,
off.
yeah,
And
yeah,
some of them are COVID survivors. Their
yeah.
tumor suppressor gene is being turned off and the oncogene is being turned up.
Goes up, yeah. And so it is very important. And also differentiation gene is there, but nobody has paid as much attention to
Right.
differentiation gene except me. But anyway, because I demonstrated that in neuroblastoma cells,
Yeah,
as
yeah,
you
yeah,
know,
yeah.
if you increase cyclic AMP level, they become mature neuron. Now they differentiate it.
Mm-hmm.
So if you correct the gene, which are but anyway, so these are so the question is, how do you reduce them?
Right.
Do you prevent that it does not happen? Well, we know that these things that we get treatment currently, radiation and chemo is main things, and damage to the normal tissue. So you reduce oxidative stress and inflammation. How do you do it? Well, we have a core four, at least micronutrient.
Mm-hmm.
EMF is the one of the best, but also don't forget intestinal dysbiosis
Yeah.
plays an important role in the initiation, contribute in the initiation of progression of cancer. So if the initiating process is oxidative stress inflammation, so if you block them, but also you have to block also the effect of intestinal dysbiosis, because otherwise it will not have an optimal, we will have effect some, but not
Right.
optimal effect.
Right.
So for that, what two is a must. Two is a must.
Mm-hmm.
And of course, we always say that um, if you have a cancer survivor, I think you can, if you have no evidence of cancer, then you can take collagen. But collagen has no significant role on this kind of issue. Collagen peptide is more important role in neurological diseases, this kind of stuff. With
Yeah.
respect to cancer, it has no significant role.
Right.
For your general health,
Right.
it is different issue.
Yeah.
But for
That can be down the
cancer,
road after the person has survived it and gotten past it.
yeah, that's right.
Change that.
And same thing applies to omega.
Mm-hmm.
For example, is very important for heart function, brain function, but it also acts some antioxidant effect, but it has no significant effect on cancer prevention issue. But in general health, this is important.
Yep.
But two is must. Two is a must one.
Mm-hmm.
And so sometimes cancer survivor have a anxiety and depression
Yeah.
because they are worried about what will happen. And for
CBD
them,
and sleep boost.
yeah, for them, I recommend also CBD.
Mm-hmm.
And brain boost if you're feeling like I have at least during acute period, say within 6 months of treatment, if you
Right.
are feeling brain fog, then I would say, yeah, please take a brain boost as well.
Mm-hmm. Mm-hmm. Makes perfect sense, Dr. Prasad.
Yeah. And
That
so,
makes
so
perfect sense.
these
Go on.
are simple things to do it. And
Mm-hmm.
of course, we always say that do a diet, good diet, but nobody pays attention to the lifestyle. We say that give up a smoking, nobody gives up a smoking. Few people do, like I did, and but not many people do. They continue to abuse themselves. Obesity is an issue, but now with GLP, there are few people who are doing it. Not, a whole country are doing it,
Yep. That's
and so you can believe it that what it is. For example, omega 3 is a national average is about 4%, which increases the risk of heart disease, all kind of health problem.
but nobody's taking omega-3. Yeah.
No, and yeah, no omega 3, and the only country Europe has same, and the risk of therefore heart disease and other thing is increasing, and Japan is the only country where the average omega 3 index, you measure the index in your blood, is 10.
Wow.
So,
Wow.
and probably you heard David Navalka is pretty good. He has about 9.5. So,
Wow.
but it varies, depending upon your age, absorption, all these kind of things. But anyway, those are for general health.
Well, I know mine was on the low side because I was not in the green. I'm down in the orange and almost in the red. I think I was like around 4 or 5.
Yeah.
So, and I had not been taking enough of the omega-3, Dr. Prasad.
Hmm.
And I've got one little brief story I want to share of that was I started having some back problems, severe. And the pain was radiating down my glutes, down my hamstring, and down into my calves on both sides. And I happened to a naturopathic kinesiologist was treating my wife's burn, and I told her I was having back problems. So she started testing me, and she said she cleared some emotional things connected to the vertebrae. But then she said, "You're low on omega-3."
Mm.
And I said, "Okay." She said, "You need to take more. I mean, a lot more." She said, "Do you have any?" I picked up your bottle, and she said, she tested it, and she said, "You need one at 9 per day." So
Mm.
she had me taking 9 per day, one every hour on the hour.
Mm.
And Dr. Prasad, like within 15 minutes, the pain went from like 8 down to about 4.
Yeah.
Next day, it was all gone. So I've been taking the 9 per day, and all that pain from my back down to my
All
calves
right.
is gone, Dr. Prasad. So using your formula.
I
So
have
she
to
said
try.
gradually reduced later. She said,
Yeah,
but
yeah,
right
yeah,
now,
of course.
I'm taking it. So I can tell you right now, it was a definite difference. I was low, and it made a huge difference in all that pain I was experiencing.
No, I have,
Personal.
as you know, but age-related, sports-related back pain, but I've managed it. But I take only one in the morning, one in the evening, two. So I will double it at least and see if maybe even triple it.
That's what I'm trying to tell you. If you take
That's
one every
fine.
hour, try it for a day and
Again,
see
it
what
is
happens.
non-toxic. It is non-toxic. These are all the things that we have made are no
Dr.
toxicity.
Prasad, I would have never taken 9 for a day. I would have never done that. But I'm doing it right now, and I will not stop. I'll tell you that right now. We
Okay.
want to share a story with you, Dr. Prasad.
Okay.
So we have one volunteer that has a bunch of
Sure.
cancer survivor stories that she wants
Yeah,
to
I'd love
share
to
with
hear that.
us. And I thought it was just kind of interesting. This is Jenny. Jenny. Jenny, how do you say your last name? Your name, Jenny? I don't.
It's Ortiz Monasterio. Half my family's from Mexico.
Okay, so
If you
Jenny.
want in Spanish, Ortiz Monasterio.
Okay. I guess the Spanish says it sounds so much cooler. So that sounds really cool.
Okay.
Thank you very much. So let's get you here up on the screen and so we can share your story as
Yeah.
well. So I'm not sure if you, oh, there you are. I found you.
Yeah.
Hey. Yeah, I turned my camera on for you.
Yes, very good. So
So
please tell us
I,
about
I
your skin cancer, and you've got a couple of breast cancer stories. Could you give us some brief?
I know, I know. So is it okay if I share my story about the thyroid?
Sure.
Well,
Okay. Well,
if
you
you could be
preferred
brief
it to be
about
cancer?
the thyroid, but our focus here is on cancer survival.
Okay. All I know, well, what I've learned is that the thyroid affects every organ system in the body. So when the thyroid isn't happy, pretty much everything's not going to be happy. And I had an accident when I was 9, and right after that, I started presenting with hypothyroidism. I was just exhausted. I'd pass out in the afternoon, and I just lived with that. I'm now 69, and I am also a concussion survivor. Long story short, I was doing the therapeutic dose for concussion, but now my testing shows I needed thyroid medication 3 months ago. Now I don't.
Oh, wow.
So I'm continuing with the therapeutic dose because my thyroid levels are improved. It could just be that the therapeutic dose has improved liver function, and 40% of our T4 gets converted to T3 in the liver. So that may be where my thyroid hormone improvement is from. Anyway, we'll see in 3 months once. But over to the cancer stories. I'm really glad that you asked me to put this because the more that I wrote, the more I started remembering everybody in my circle. It's like, oh my God, every other person is having major experiences with cancer,
Wow.
starting with myself. Beginning about 5 years ago, I started having skin cancers, and I'd go out in the sun a lot, granted, but I love my vitamin D. Let me just say that. And so if I ever feel anything come up, I've gone to my dermatologist, and he'll just freeze it off. And since I started doing a therapeutic dose in the last 3 months, what I have noticed profusely is that there's been a rapid sequence of things coming up to the surface. And I'm thinking, oh, I better get into my dermatologist, have him take a look at this. I'm busy. I can't get in right away. And then it goes away. So it's bringing a lot to the surface, minor things that what my dermatologist would call something between precancer and a mole. But I don't have to go to him for these, freezing sessions, which are not comfortable. And another story, I've got a very good friend. She has a lump in her breast. She's been doing 3 bottles a month. And so that's 3 doses. I'm sorry, it's a double dose 3 times a day. And she's also on a triple dose of the probiotic. She takes one in the morning, one at night. He was working with another practitioner for a long, long time. Nothing was going down. She worked with me for 2 months. He's still continuing, and it's now getting smaller almost immediately.
Mm.
Wow.
Wow.
And I have another individual that just started chemo and radiation, but before she started the chemo and radiation, she started on the therapeutic dose, which is 9 capsules 3 times a day with a lot of probiotic. And even before she started chemo and radiation, hers started going down. And I think I wrote one other story. Um, I mean, there's so many of them. I can't, it's hard to keep track of all of them, but it really is fun being a part of this. And the only thing that I want to add to that is I just want to acknowledge that the work that it takes for us as educators, and I do consider myself an educator, to keep people on track. It's like people want to go on, they'll get an idea of what they have to do, and then they'll go off and do something very different. And
Hmm.
so I just want to remind us all that it's very important to check in with people, see how you're doing and how are you dosing. The one woman that's on chemo and radiation, she's in a little bit of an overload right now. And she was going to put her supplements on hold while she was moving. And I'm saying, I just had to take a deep breath and walk her through that and, just make sure but that's why we have to keep in touch with people.
Absolutely, absolutely. Well, Jenny, am I saying it
Jeannie.
right? Jeannie, Jeannie, thank you very
Thank
much.
you. Thank you.
That's remarkable, and we certainly appreciate your following through and
Yeah,
keeping
yeah,
in
that's very
contact with
important.
your clients.
Yeah, that's very
Um,
important to follow up.
your skin cancer story, your story, and the others are just amazing. So this is not uncommon. This is not
Yeah,
uncommon, and so she's got several folks that have had those kinds of results. Um, we're going to share a couple more because there's a lot of folks that are on this meeting right now
sure.
who have never heard some of the stories that have been related at some point in time. I'm just going to briefly relate one or two of them. We have a lot of their recordings, firsthand, but some of them it's just the stories kind of they're self-explanatory. And just as a reminder for everyone, testimonies are pretty anecdotal. What happens to one person may or may not happen to you. So these are people sharing their own personal stories. This woman here, I've known her now for a number of years, Iris. She began using therapeutic doses of hydro. That's all that she had at the time. This is going back about 4 or 5 years, 5 years now. And that's what she started taking was therapeutic doses of hydro. And she underwent every form of conventional treatment for her breast cancer, surgery, chemo, and radiation. And when she tells her story, we have the recording, and she says that she had no hair loss, she had no pain, and even when she went on the tamoxifen afterwards to stop the recurrence, she was not having the side effects of that medication as well. And so she's still doing well to this day, and she's very excited about the results that she got. This gentleman here took therapeutic doses of your formula, Dr. Prasad, just before, at the exact same time that he began the aggressive treatment, radiation, 33 rounds of it,
Yeah.
for basal cell carcinoma. And that's his picture there on the left, August of 2023, and on the right, November 2023. You can't even see anything any indication that the problem was there. And he didn't lose any of his hair, nothing.
Yeah, that's amazing.
That turned out to be a very successful treatment. This woman down in Ecuador, the official diagnosis right there on her medical record is melanoma. And for any who are a little bit more squeamish about an open wound, this next picture is also going to be an open wound on the foot. So I apologize, I didn't warn you about Rick a minute ago. But this is on the bottom of her foot. April of 2024, this picture was taken. April the 18th exactly. April the 18th is when this first picture was taken. This next picture, she began taking therapeutic doses of your formula, Dr. Prasad.
Mm-hmm.
On April the 22nd, it already showing signs of drying up and improvement. That's just 4 days later. And you can hardly tell where that first nasty gash was, but the doctor had recommended amputation. This picture here, taken on the 28th, another 6 days later. And all you're seeing is a little bit of dead skin at this point.
Within 1 month.
Yeah, and just some dead skin. And then here it is now on May the 1st, May the 2nd. That's it. You can't even tell that she had the same melanoma on the bottom of her foot. When the doctor saw her again after it had healed, he thought he couldn't believe it was the same person. He just did not believe that this had taken care of itself. So spontaneous remission probably is how they would classify it. But April the 18th was when she had the risk of losing her foot. On May the 1st, it was all reconciled. And
That's
so
amazing. 2 weeks.
that's just it's hard to even wrap your mind around the
Yeah,
fact that something like that could happen, Dr. Prasad.
I know.
But this is how we summarize what you have been sharing with us and your research, and other scientists have corroborated the same thing. And folks who are here right now, if you're looking to survive cancer, remember, how do you put it here, Dr. Prasad? Cancer cells require two things, glucose and glutamine, in order to.
Yes,
If you deprive the cells of these two things, they cannot continue to advance. Now, Dr. Prasad says they die, but I try to put it here real nicely. But he says the cancer cells die when they don't have glucose and glutamine.
exactly, exactly.
So that's an absolute must.
And the chemo and radiation therapy kills cancer cell as well as normal cell by generating free radicals. So mechanisms are totally different. So if you want to have radiation, you can. People have taken it, but it will be not only it will kill this cancer cell by free radical, but it will protect normal cell from free radical damage. So it in one hand it is blocking the effect of glucose and glutamine, and on the other hand is protecting normal cell against free radical damage.
That's a powerful combination right there. I see Charlie Rayford, who was connected to the woman down in Ecuador. Charlie, do you have an update for us that you want to share?
The Bernard was saying that he has some connection, isn't it?
Yes, and Charlie Rayford is the affiliate that was actually down there, and he's got his hand raised right now. So I think he's probably trying to unmute.
I have to unmute.
There you are. Now
Okay, can you hear me now?
yeah.
Yeah.
Yes. Yes, I was the one, and as a matter of fact, they have been taking the micro daily ever since that time. And I checked with them last week. I had a discussion with them. They got more micro daily, and it hasn't come back at all. She's still cancer free in
That's
her circumstance.
that's amazing.
And did you ever give us an update as to what the doctor's comments were after she went in for treatment and he didn't have to cut her foot off?
Well, this doctor, it was a woman, and she couldn't believe it. And so she asked them to bring whatever they were taking in. And so and she wanted to bring it the next day. So they brought it the next day, and she wanted the box so she can look at the ingredients. So she looked at the ingredients and says, well, this doesn't make sense because it's all natural. All those things are good for you that contains in this product. And I just don't understand. She said, so I want you to go to another clinic. So because they went to the best clinic in the country of Ecuador the first time. So she wanted them to go to another clinic to verify. So they went to the next clinic because the last time that she saw her, that they were about ready to cut her foot off. And the next time that she saw her, there was no cancer in her body. And so she just couldn't believe it. She was in shock. So she sent it to another clinic, and they went to another clinic, and they took the what they call it. It was they checked her body from head to toe. And by the way, she had cancer more than on the bottom of her foot, melanoma. She also had cancer in her lymph nodes under her arm.
Ooh.
And
So they did CAT scans and PET scans, and they still couldn't find
yes,
any more cancer.
they said there was no cancer found in the body.
Wow.
Wow.
And that was so she went to the second place, and they said the same thing. And the doctor says it just doesn't make sense. They couldn't wrap their heads around it. You just and so um I think they changed doctors because she just couldn't she couldn't wrap her head around it. She just didn't know what to do.
Wow.
And
Even
so
sometimes I ask patients that if oncologists have question, they can call me directly and I will be glad to explain it.
I'm glad that you think doctors really want to know the explanation, Dr. Prasad. But
But I mean, soon, I think I would say within next 12 months, we will have a clinical data run at the real cancer center in both countries, in the US and as well as in Brazil.
okay,
Good. I hope you have it in Spanish.
And
okay,
yeah, and so in that scenario, if the data is positive, the way we are thinking about it, there will be, a new world of cancer treatment. We are not interfering with your thing, but try 1 month before, and if any tumor is left over, then you want to give some radiation or chemo, is okay. But if you think that, well, it is regressing so much, I will wait another 2 weeks before I give a chemotherapy, and by that time there won't be any tumor.
that's beautiful. Thank you, Charlie, for the update. Much
But in the
appreciated.
beginning, for political reason, you have to say this is a supportive care to a
Right,
standard therapy.
that's it.
Otherwise, they would not go for it.
That's it. That's the only way to do it. You can't have it as a replacement. We have a hand raised. Janet Burt, is this question about cancer or a comment about cancer?
No, it's a comment about my fears. I went to the doctor for my regular colonoscopy. Well, 10 years, I'm 79, and 10 years prior, there was nothing. Now, when I had it a couple of months ago, well, about a year, I had 7 polyps. And I have a high risk of cancer. My mother, my sister, my aunt. So I want to know what I can take specifically, because I believe in this science altogether. I've always been into some kind of health stuff. So you don't have to convince me. But a doctor, gastrologist says bentonite stops polyps from growing. Everybody that I've ever knew that had polyps, they came back. I want to know what is my best route, because they want to see me again in 3 years. To me, that says it takes 3 years for them to grow back.
Okay, all right, that's a good question. So, Dr. Prasad, her question is, she's got polyps in her colon. She wants to know what recommended protocol she should go on to
Yeah,
reduce the chances of her getting them back or
yeah.
going
If
to
there is
cancer.
an active polyp there, say for example, then she should go to therapeutic dose. But right now, if she has no polyp in the gut right now, say for example, surgically they removed it, so
Yeah,
they
they said they were benign and they cut all 7 out.
yeah. So, but the question of reoccurring is always there, and so I will say that right now you take just a preventive dose of a microdaily EMF and at least 2 and probiotics with prebiotics. Those 2 things are extremely important, and depending upon how other health issue you have, Jonathan can advise you further.
A little bit more. In fact, Janet, to that end, just so that you know, for those of us who do not have any serious health problems, I've got back problems that I just described. I take double the normal dose because then I need a little bit extra. I'm in my 60s, you're in your 70s. So my suggestion to you would be to take at least double doses of microdaily and then take all of the rest of the core 4. And you
Yeah.
should see some very good results when you get ready to go back to your doctor, okay?
All right. Well, it is. I do have a problem with cardiac heart disease. I had
Yeah, so you have to have a course
heart
of
failure.
mentioned,
So
yeah.
I ordered the boost, the heart boost, and probiotics, and another one came with it at 3.
Micronutrient TMF is a must.
Yep.
Okay, so does that come by itself?
Yeah.
Yes, it does. Yes, it does. And I'm going to show you a little bit more about those very same products that we're talking about now. And this is not just for you, but this applies to everyone.
Okay.
Okay. So just focus in right now on the rest of this, and you'll see for yourself just exactly how this is going to benefit you. All right. And 1 second, Diana. But this is the main product that Dr. Prasad, all of the folks who are taking something to try to help their body fight off the free radicals and the onslaught of some sort of cancer, or to survive it. This is the main product that they were taking: microdaily EMF, the hydro, or the capsules. The choice is yours as to which one you decide to take. But either way, triple the dose is normally what's taken when it comes to specifically cancer itself. Again, not a treatment or a cure, but this will help the body have the right nutrients in it to fight it off. The probiotic that Dr. Prasad talked about, to make sure you do not have intestinal dysbiosis, to change the bacteria in the gut in favor of good bacteria. The omega-3, and Dr. Prasad said it very clearly, this has no direct impact on cancer itself, but overall health. This is great for circulation. I just told you what happened to my back. I would not have believed that this would have had that kind of an impact on my back, but it's great for circulation, great for the heart, great for the brain. And it just so happens this month, and this will be good for you, Janet, the company Engage Global has a flash sale going on right now where you buy 2 omega-3 and you'll get 1 heart boost for free.
So yeah,
that's
very good.
Stock up on this, Dr. Prasad. I'm about to buy a whole bunch of this.
Yeah.
Because with me taking high doses of it, I do not, the pain that I felt in my back going down to my calves on both sides, I don't want to ever experience that again personally. So I'm not going down this road. I'm going to have a whole lot of this. And then Collagen Daily. This is for someone who does not have active tumors, but for general health, this is part of the equation. I take double doses of this every day. So this is the core 4 right here. This is the normal package that that it all comes bundled together, and then you can add to this, Janet, an extra micro daily. So you buy this as a bundle, and then you add 1 extra micro daily to this order. If you have problems with digestion, add the digestive boost. I never run out of this as well. Especially if you're a meat eater like me, you could take 2 or 3 of these after your meal, and you'd be amazed at how your gut is calm and everything works fine. For those who have taken chemo and are dealing with chemo brain or brain fog, this is great. I take 2 of these brain boosts twice a day. I have never had chemo, never will personally. But I take 2 of these twice a day, and it keeps my brain on point. I love it. I will never run out of that brain boost. I take 2 of these at night, and it slips me almost into a coma. I hit REM sleep, and I've been doing phenomenal. Along with 2 of these at night, Dr. Prasad, let me tell you, my sleep has never been so sweet than when I add those 2 things together. Now, here's the cost. If you were to buy the ingredients that Dr. Prasad put together in these formulas, I'm telling you now, it will cost more than $1,000. If you were to buy the packages, the products as seen, it would be $310.62. I think it might be a couple dollars higher now. There was a recent price increase. But Engage Global is subsidizing your health. Wholesale, the price that I pay for this bundle, is $250. But anyone else who just becomes a subscriber for this can get it for less than $200. So this is the way to go, Janet, as a bundle, and then you add to it 1 or 2 more of the micro daily by itself. And then you've got the full complement of what you need. Whatever you do, when you start your subscription, do not stop until after 90 days. Stick with it for at least 90 days if you really want to see the full results of it. And do not take half of it. Do not take a third of it. Take all of what you're supposed to take as recommended. But the person who invited you here, they can help you with that. And Dr. Prasad has said that this is the very minimum. If you're fighting cancer, and you're trying to survive it, this is the minimum that you want to take right here. These 2 items is the minimum that you want to take. I would suggest that you make sure that you get this bundle and then add to it 2 more bottles of micro daily. 2 more bottles of micro daily. That way you can take triple the normal dose.
Yeah.
Give yourself a good chance. This is the best way to go. But the person who invited you here to this discussion, they can help you to figure out which one of the bundles and how to put the combinations together that will help you. But I had good news for you guys. We're not done. If Dr. Prasad's available, we're going to be talking about this again next week. So we're going to be doing part 2 of this discussion because the month of June is National Cancer Survivors Month. So we will revisit this discussion next week. So if you guys know anyone who has a story, anyone who's a cancer survivor, anyone who wants to be a cancer survivor, get them here next week. Because I'm telling you now, Dr. Prasad could not share any more than a fraction of what he knows. I mean, I'm talking about a very minute fraction of what he knows about this subject. That's all we heard today. So you want to make sure that you're back here next week so we can do a follow-up on this discussion.
Sure.
So Dr. Prasad, I got a couple of hands raised here.
Sure.
Maybe we could just take this one question or comment here. Diana, is this a comment or question specifically about cancer?
It's a real quick question about cancer. I'm a registered nurse and been a nurse for 36 years. I was just invited to this group, had no idea what to expect. So I'm glad I came in on the tail end. About a month ago, I was diagnosed with right breast HER2 cancer that involves 2 lymph nodes. Still going through a lot of the staging, so I don't know the stage yet, but would love to know more about the products. I don't even know who to reach out to, so a website would be great as far as, so I can get started ASAP.
That is very good. That's very good. I would suggest you do this. The person who sent you the invitation, get back with them, and they can connect you with more details and more research on it. If you just want to hear some more of Dr. Prasad's lectures on this, my YouTube channel has a lot more recordings on it. Some of the previous discussions on breast cancer and other cancers.
Yeah.
YouTube.com/Jonathan Jones, and you can hear some of the other recordings. But get back to the person who invited you here, and they can help you. Okay.
And because our approach of therapeutic dose and probiotics is inhibits glucose and glutamine. So cancer cell at any stage doesn't make difference. As long as they are cancer cells, they will die. But there is a treatment sensitive, tumor resistant, what form, breast, any kind of, as long as they're cancer cell, it doesn't make what kind of cancer cell. It does make difference. They will be affected because all of them need glucose and glutamine for survival.
It's like music to my ears when I hear that statement. I just love hearing that. Thank you for sharing that, Dr. Prasad.
Thank you.
All right, so good. And Dan/Norma Williams.
Yes, I've been taking the micro daily that's in the green bottle. What's the difference? I have quite a few of those bottles, but I have the rest of the core. So, I mean, should I continue with the green and then switch to the red bottle or what?
That's a very good question. And I can tell you this, that the green formula, the green bottle is the original formula. It has the exact same high doses of the exact amount of antioxidants as the red bottle. Okay, same amount of antioxidants as the red bottle. You can continue with that if you're taking it therapeutically, but you got to take triple the normal amount. I would suggest that you add at least 1 bottle of the red. So 1 dose of the red as part of your triple. So you can do 2 doses of the green and 1 dose of the red, and you're still getting triple doses of the high dose antioxidant that Dr. Prasad recommends, okay?
Okay, and one final question. With the collagen, how do you take that? I just got that the other day.
Stick it in your put it in your coffee or your tea. I put a scoop and a half in my tea every morning is the way I do it, and then another scoop and a half in my in a drink or in just water later in the day. So I'm doing double the normal dose. That's a lot. But if you have active cancer cells, Dr. Prasad recommends you not take it. Okay.
Cancer cell collagen is no.
Right. Yes, that's for healthy folks that they take the collagen. So if you're fighting cancer, just put it in a freezer or in a refrigerator, and then once you're cancer free, then you can start taking it. Okay. And Sherry Blocker, you got the last word on this.
Yes, I have a quick question. What would be the doses that you would recommend, Dr. Prasad, for a condition called MGUS? It's like an abnormal protein that's in your blood. And I looked up some information, and some of it did say something about like precancerous cells. So what would be your recommended doses for that? It's not cancer.
You have to send me exactly what problem is.
Okay.
Do some research because I don't know under that condition.
Okay.
So for next Sunday, I can provide you information. Send the information to Jonathan, and he will get in touch with me. And then next week, I can answer your question.
Okay,
And
I'll do
I can
that.
tell you this, Dr. Prasad, I had a case like that about a year ago. So I can send you some details on that and so that you can. But my email address is eg@jonathanejones.com for anyone who wants to send information that needs to get to Dr. Prasad. I just put it in the chat.
Okay, thank you.
Yep, you're very welcome. And my YouTube channel, someone just asked a question about that too. I'll share that link with you. But Dr. Prasad, we can't thank you enough for your being willing to help us to navigate these very complicated issues and to have rock solid scientists to be able to answer questions right at our fingertips. Thank you very much for that, sir. So